We need to take COVID-19 very seriously. We wanted to make this video because a few patients recently told us that they heard the world is overreacting. Now we know better. It's not a hoax. We need everyone's cooperation, and we'll show you why. Prior to your visit, we'll contact you to see if you have any symptoms or risk factors that could be consistent with COVID-19 infection. We'll ask you about fevers or chills, fevers being the most common symptom. Cough is the second most common symptom, which is dry, non-productive, 2/3 of the time. Almost 40% of the time, people experience fatigue, and almost 20% of the time, people experience trouble breathing, which is the most serious symptom of this virus because it does have a predilection for the deeper lung tissue if it penetrates that far. Muscle aches, headaches, sore throat, all about 15%. Runny nose and congestion is only 5% of cases. However, in kids, it's much more common. Nausea, vomiting, diarrhea are also rare symptoms. We need to know if you or your family has had contact with sick people in the past month, especially contacts with COVID-19. The incubation period for this virus is 2 to 14 days, average being about 5.5 days. So it could take some time to work through your family, and it can do so sometimes asymptomatically. We absolutely want to stress how important it is to answer these questions truthfully. Suspect patients who need to be seen might require special arrangements so we don't put others at risk. Consistent with our governor's leadership, practices will be postponing elective visits and surgeries. We're not the only practice doing this. To limit exposure, some patients might be asked questions over the phone instead of an office visit. While inconvenient, here's why this is important. Here's a few web pages that many of you have likely seen already. First of all, this virus is very contagious. It can spread exponentially. Look at that graph, how it shoots upwards so suddenly. As you know, a week ago, South Korea, Iran, and Italy started experiencing exponential growth. If we carry on with poor measures, very soon we will look like some of those countries. Although this started in China, China acted very quickly to stop the spread of this virus. In the early stages, early December, there was not many cases. In the gray, you can see where patients were calculated to have contracted the disease. The orange is the number of patients that were diagnosed officially with the disease, which usually starts when they have symptoms. Because the virus has to incubate for several days before you get symptoms, based on a chart of when people get symptoms, you can go back and plot when they must have got the infection. This point in time represents when the Chinese government put their people on strict lockdown. Notice they only had about 400 known cases with symptoms at that time, but what they had brewing was 25,000 cases in gray that were destined to soon develop symptoms. So although it seemed like the infection was still spreading after lockdown, actually what most of that is the unsymptomatic cases later becoming symptomatic. So the Chinese government about here put everyone on lockdown, and most of these lines are other Chinese provinces who did not experience the exponential spike that South Korea, Iran, and Italy later did. So COVID-19 is a respiratory virus somewhat related to the common cold. How can that hurt somebody? Without getting too complex, it has to do with how far the virus spreads. Although a cold's most typical symptoms would be a runny nose, nasal congestion, or if it drips down to irritate your throat and cause a sore throat, most patients with COVID-19 don't have these symptoms, excluding children. COVID-19 has a stronger predilection for the deeper parts of the airway. If it affects your voice box, you'll get a cough, often dry, with laryngitis, perhaps some hoarseness. If this goes farther down your airway to your bronchioles, you get some wheezing with that cough, with a bronchitis. And if the virus goes all the way into the air sacs of your lungs, then you have a viral pneumonia, which of course can cause a worsening cough. The virus has a strong predilection for tissues here, which is why it can be so bad if it makes it this far. So just imagine if all the swelling, soreness, and oozing that we often experience with a common cold in our nose were actually taking place in the air sacs of your lungs with nowhere to go. You might need an ICU bed. So COVID-19 is very contagious and can spread very quickly. But just how deadly is it? That's where it's confusing. Look at this report from Johns Hopkins Medical Center from the 13th of March. Here it says that the mortality rate from Korea, where they tested extensively, is only 0.12% for those under 60. But we need to be careful. In pandemics of old, we don't know how many asymptomatic carriers there were because there was no viral testing back then. When you look at France, the young certainly don't seem invincible to this virus. We have to be careful as scientists sort this out, but at the moment, about 1 in 5 patients require hospitalization. Of those going to the hospital, about 1 in 4 need to go to the ICU. Unfortunately, a significant percentage of patients in the ICU do die, often older with other problems, but not always. So what do scientists mean by saying we have to flatten the curve? As time progresses from left to right, the higher this graph goes, represents more and more people all having the virus at the same time. Because we only have so many ICU beds and so much ICU equipment, if too many people have the virus at once, they're just going to die from not having enough help. If we can reduce how many people get the disease all at once while increasing our hospital capacity, then those who need help will not outnumber the amount of help we can give. This next article shows us how we can flatten the curve to prevent dangerous exponential growth of the virus. So in these illustrations, a person who is orange has the virus, they give it to someone who was previously healthy, who was blue, and then once they turn purple, they are recovered. And notice here, everyone is moving freely with no restrictions, and look how quickly the virus spreads. Look how high the number of people at any one time gets with the virus, overwhelming hospitals as a result. If we quarantine, we'll definitely limit the number of cases. But if the quarantine breaks down, the caseload can still become overwhelming. And finally, if people stay still and reduce their number of interactions, look how much more slowly the caseload builds. The total number is much less likely to overwhelm the system at any given time. We're so thankful to the scientific community and those who make articles like this to educate us. Let's obey guidelines as they become available from the scientific community, and let's keep one another safe until this passes.